This video is going to be all about talking about and describing pain, which is very important for your health. So I have a different video that goes over the 24 parts of the human body on this picture. But this is a reminder of the parts of the body as we begin talking about pain, where something hurts. Okay? So often, if you go to the hospital or the doctor's office, they will ask you to rate your pain on a scale of 1 to 10 or 0 to 10. This is what that scale looks like. This is what they are asking you. So if you have no pain at all, excuse me, your pain would be a 0. No pain, feeling great, nothing hurts. And then the scale goes up all the way to a 10, which would be the worst pain possible that you've ever felt. Okay? Most of the time when we have pain, we're somewhere in the middle. When you give your number, it tells your provider how much pain you're in and helps them decide if you need medicine, if you need physical therapy, if you need to stretch, and helps them plan your care. Okay? Here on the right side is another way to think of this scale. Okay? So it's the same scale. 0 is no pain, okay? But it goes up to 10 and gives some better description and some words to help you describe your pain. Let's take a look. 0 is no pain. I have no pain. Number 1 is minimal. That means only a little bit. My pain is hardly noticeable. It's not a problem. Number 2, mild. I have a low level of pain. I am aware of my pain only when I pay attention to it. Number 3, uncomfortable. My pain bothers me, but I can ignore it most of the time. Okay. Number 4, moderate. I am constantly aware of my pain, but I can continue most activities. Okay. This is something that providers want to know. How much does your pain affect or impact your daily life? Okay. So at number 4, something hurts. You have pain, but you can still go to work. You can still do some exercise. You can still do your daily life. Number 5, distracting. I think about my pain most of the time. I cannot do some of the activities I need to do each day because of the pain. Maybe it's difficult or hurts to do stairs, so you do not go downstairs to the basement to do laundry. Maybe it hurts to bend your knee, so it is difficult to use the bathroom. That's important to tell your provider. Number 6, distressing. I think about my pain all of the time. I give up many activities because of my pain. Okay, so it's starting to get more serious. Number 7, unmanageable. I am in pain all of the time. It keeps me from doing most activities. Okay, so again, we're stopping many activities in the day. Number 8, intense. My pain is so severe that it is hard to think of anything else. Talking and listening are difficult. Okay, so if it's hard to have a conversation, talk and listen because the pain hurts so much, now we're at a level 8. Number 9, severe. My pain is all that I can think about. I can barely talk or move because of the pain. And number 10, unable to move, which means cannot move. I am in bed and can't move due to my pain. I need someone to take me to the emergency room to get help for my pain. Okay, so again, providers will ask you on a scale of 1 to 10, how is your pain today? You will answer on the scale of 1 to 10, and you need to understand what number you are giving and what that means. This will help you. Okay, let's look at the next slide. We also have many adjectives in English for describing the type of pain that you're feeling. Okay. So the scale of 1 to 10 is how much does it hurt? The severity of the pain. These words will help you describe the pain to a provider, what exactly it feels like. Okay. So first we have aching, a long-lasting, not too serious pain, typical of tired or injured muscle. Okay. So if something aches, it means that there is a general pain, a little bit of a pressure. It feels sore. Okay. You just need to stretch it, but you are okay. Agonizing or excruciating pain, those words mean very bad. Excruciating means very bad. You can't think about or do anything else. Okay. Burning. Okay. So we know that burning can be the feeling of when you touch something hot. Okay. But sometimes if you have an infection or a wound on your skin, it can feel like it is on fire. It can feel hot to you. So you might have a burning pain. You also might have a cramping pain. This comes on suddenly and feels like your muscle or intestine are tightening painfully. Um, Athletes can get muscle cramps in their leg or their arms. Lots of times we also get cramping in our abdomen, in our middle section. Okay. It can be if you have eaten too much, if your stomach hurts and you need to use the bathroom. Cramping is a pain in your abdomen or muscles, okay? And it hurts. Gnawing pain is a persistent, dull pain, similar to hunger pains. Gnawing is when something keeps bothering you and it's annoying, but it's okay. You might be gnawing when you are hungry and you can hear your stomach making noises. Okay. The feeling of pins and needles is a mildly painful feeling like when you sit on a foot or hand and it falls asleep. So if you lay in a certain position and you wake up and your hand feels weird, it feels big, we say it's asleep and you're trying to get regular feeling back in it. Same if you're sitting on the floor and you're sitting on your foot and you try to get up and your foot feels numb. It feels pins and needles as you try to wake it back up. Pounding is like something is beating on you inside. Okay. Pounding feels like a rhythm of boom, 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 boom. Okay. So sometimes we say we have a pounding headache. That is also synonymous. It's the same as throbbing, which is down here lower on the list in English. Throbbing and pounding are that same boom, 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 boom feeling. Pressing is like something is squeezing you or sitting on you. Many times, if people are having a heart attack or a heart problem, they feel like someone is sitting on their chest. They feel that pressure. Radiating pain. Pain seems to flow from a central hurt to somewhere else, like down an arm or a leg, front to back. So if you have pain that is radiating, you are explaining to a healthcare provider where the pain started and where it feels like it's going. Maybe I have shoulder pain, but now the pain is radiating down my arm. I can feel it in my hand. Maybe I have low back pain, but it is now radiating down my right leg, and my right leg, it feels that pain. Okay. So if the pain is traveling, moving, it is radiating. Sharp or stabbing. It's pain that comes quickly and feels like being stuck with something sharp. In English, if you stab something, it means that you've taken something sharp, like a knife, and you have pushed it into something. Sharp or stabbing pain means you feel like someone is pushing a knife into you, into your side, into your head. The pain feels that intense. A shooting pain is synonymous with radiating. Shooting pain means sudden, severe pain that moves throughout the body. I have shooting pain from my shoulder down my arm. I have shooting pain from my back down my leg. Stiff is similar, not exactly the same, but similar to aching. It's usually in muscles or joints that hurt to move or can't move freely. Sometimes stiff means an ache, a pain, and you need to stretch it out. Stiff means that it feels difficult to move. So maybe it hurts to bend your knee. Maybe it hurts to make your leg straight. Maybe it hurts to move your shoulder. Okay. Stiff means it's hard to move. It feels stuck. Again, throbbing is synonymous with pounding. Gets worse and better in a rhythm, often with your heartbeat. Okay. So if it's doing the boom, 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 like your heart, it is throbbing or pounding. And tight means a body part feels like it's being squeezed. Okay. So sometimes muscles can feel this way. All different parts of the body can feel like someone is squeezing you, like it is tight. And these are some of the questions that you might be asked when you are talking about your pain with a healthcare provider. They might ask how long you have had your pain. Where do you feel the pain? Is your pain in one spot or spread out? How does the pain feel? So those are those adjectives we just looked at. And how severe is it? That's the number scale. Is the pain constant, which means all the time, or does it come and go? What activities make the pain worse or improve it? How does your pain limit what you can do? How often does the pain occur and how long does it last? And does anything trigger the pain? Trigger means start. What starts your pain? When you do what? Okay. So again, these are ways to talk about and describe your pain. And this will help any of your healthcare providers to better support you if you can better explain and describe what hurts, how it hurts, where it hurts, and why. Thanks for watching.